Good day, I am Aldrin Havaliano and this is CHN Skill Home Visit. So by definition, a nursing home visit is a family nurse contact which allows the health worker to assess the home and the family situation in order to provide the necessary nursing care and health-related needs. So there are five purposes of this procedure. First is to give care to the sick, to a postpartum mother and newborn. Second is to assess the living condition of the patient and his or her family and their health practice to provide the appropriate health teaching. Third is to give health teaching regarding the prevention and control of disease. Then fourth is to establish a close relationship between health agencies and the public for the promotion of health. And fifth is to make use of the inter-referral system and promote utilization of community service. Principles. The following principles are essential when performing a home visit to achieve the best results or the desired outcomes. So number one, a home visit must have a purpose. Number two, planning for the home visit should make use of all of the available information about the family through family records. Number three, in planning for a home visit, one should consider and give priorities to the essential needs of the individual and his or her family. Fourth, planning and delivery of care should involve the individual and the family. And fifth, the plan should be flexible and practical. So, the following factors are to be considered regarding the frequency of home visits. So number one, the physical, physiological, and educational needs of the individual and the family. The number two, the acceptance of the family for the services to be rendered and their interest and also their willingness to cooperate. Number three, the policy of a specific agency and the emphasis given towards their health program. And number four, take into account the other health agencies and the number of health personnel already involved in the care of a specific family. And number five, the ability of the patient and his or her family to recognize their own needs, their knowledge of available resources, and their ability to make use of their resources for their own benefit. And six is the careful evaluation of past services given to the family and how the family avails of nursing services. For the equipment, there are a few things or articles needed in this procedure. So first is an apron, a medicine or medicines, dressings, CHN bag, stethoscope, and sphygmomanometer. So to perform this procedure, first greet the client or the responsible family member and introduce yourself and also state and explain the purpose of your visit. This is to prepare the client and relieve anxiety. So for example, good morning Mrs. Reyes. I am Aldrin Havaliano and I am a nursing student from MSU IIT. So I am here to conduct a home visit for you and your family. Then, observe the patient or the client and the other family members and determine their health needs by asking them about their health and their health related problems because assessment is an essential part. This may be of use or this may help the nurse in planning what intervention must be done. Proceed by putting the bag in a convenient place and then proceed to perform the bag technique to perform the procedure easily. So using the bag technique, first we must get a paper lining or linen and put it in the surface before putting down your bag to avoid microorganisms into contacting your CHN bag. Then wash your hands. So assuming that I'm already done washing my hands, next step is to wear an apron. So take out your apron and and then put out the needed articles and or the medicines or dressings from the bag. So this is for organization and easy procedure, also to eliminate the microorganisms from the hand through the hand washing. So before putting down your articles, you must first get another linen to serve as your workplace, and then put out the needed articles. So for example, the patient needs to be checked for the vital signs. You may take out your sphygmomanometer and stethoscope and also your thermometer. So then perform the assessment and the appropriate nursing care needed. And if more than one member of the family needs health supervision and care, start with the well member to the unwell. So this is to give enough time to focus on the family member that needs more care. So next is to provide the necessary health teaching based on each member's needs and condition. So this is to effectively teach them based on their own needs. And then after you're done doing those, wash your hands again to prevent the spreading of the disease and infection. And then put off your apron and put it in the bag, as well as the articles that you took out, assuming that you're already done cleaning them or sanitizing them. Then when you're done, close the bag to prevent the spreading of the disease and infection. Then also fold this one and put it back in your bag. So when you're done with all of that, the last thing you should do is record all the pertinent data, observation, and the care rendered, so it could serve as a reference for the next visit. So after that, before you leave the home just yet, make an appointment first for a return home visit or clinic visit. This is to monitor the condition of the patient or the clients and his or her family and discover potential significant findings. And then on the next visit, especially when the nurse has gained the family's trust and confidence, he or she may look into more detailed aspects of the household, the surroundings, and other health concerns. So this is gonna help, because looking into a more detailed aspect of the household gives the nurse an idea on why the patient is in such a condition or state.